Hello everyone. In today's session we want to see or to talk about proteinuria. And under proteinuria we're going to see the causes of protein to appear in urine beyond the normal. Because we know proteins are very essential in the body, so we don't lose them in urine. If it is beyond 50 milligrams per deciliter in 24 hours, that is what we are regarding as proteinuria. And if it is your first time in this session, please go to the subscription button below and subscribe. You can like the video and then share to others. So we are going to talk about causes of proteinuria and different methods that we can use to determine presence of proteins in urine. And the term proteinuria is presence of proteins in urine greater than 50 milligrams per deciliter in 24 hours. So if we find there is presence of 50 milligrams per deciliter of proteins in 24 hours, there we can declare that you have proteinuria. So the reference range is proteins appear minimal in urine, but they should not be greater than 50. So if it goes beyond that, that's where we say there is proteinuria. And there are different causes. And one of the causes of proteinuria, we are going to see among the causes, one of them is glomerulonephritis. This is the inflammation of the glomerulus. You can call it inflammation of glomerulus. We know that the glomerulus pore, it should not be bigger. And because the proteins are big in size, they are not filtered within the glomerulus. So if we find there is proteins in urine, meaning inflammation of this glomerulus or the filters has happened and is causing urine to appear, proteins to appear in urine. And we know that the components of proteins is majorly albumin. Albumin is the major protein and is the one which is commonly filtered in reference, but globulins are big in size and they are not commonly filtered. So majority of the protein is in the form of albumin. So sometimes we can call it albuminuria. Then another cause is pyelonephritis, whereby pyelonephritis is due to presence of pus from bacterial infection. Severe bacterial infection affecting the kidney is what we call pyelonephritis, characterized by presence of pus. Then we can also talk about hypertension causing this. Hypertension and eclampsia. Eclampsia, this is whereby in pregnancy we find proteins in urine during pregnancy, and this one leads to edema and so many things. So during eclampsia we lose a lot of proteins in urine and it can lead to proteinuria. Then another cause of proteinuria, we can look at tubular diseases. And these tubular diseases affect reabsorption of proteins. Because albumin is small in size, it can be filtered, but after being filtered, it should be reabsorbed. So any problem with the tubular disease affecting the tubes of the kidney nephron can lead to presence of proteins in urine. And another one is nephrotic syndrome. Nephrotic syndrome is also the cause, can cause proteinuria. And other causes we can see is urinary schistosomiasis. When you have schistosoma hematobium, schistosomiasis can also lead to this, and this is always characterized by hematuria. presence of blood in urine. Then we can also see it in diabetes, in uncontrolled diabetes due to presence of microalbumin in urine. So even diabetes patients, we can find it. And another one, which is the last one, is severe UTI, severe lower urinary tract. UTI. So these are the causes of proteinuria. So after looking at the causes of proteinuria, then we have to look at the methods of determination. The methods we can use to determine proteins in urine. And these methods include, one of them is protein reagent strip. Protein reagent strip. And this protein reagent strip, we can also call it arbustic. Arbustic because we told you much of the proteins that are found in urine are in form of albumin. So the heuristic, we can call it arbustic because we are majorly dealing with presence of albumin in urine. Then another method we're going to talk about in this session, we're going to discuss about using sulfoxylic acid, and which comes in either 3% or 25%. Then another method we are going to look at is the quantitative, that is TCA. So let us begin with arbustic or protein reagent strip. And this protein reagent strip, here we obtain, or the principle of this method. The principle of this method is that when this reagent strip or arbustic contains an indicator which is known as tetrabromopheno. So tetrabromopheno is an indicator, and this indicator is yellow in color at pH of 3.0. So this tetrabromo indicator is yellow in color at pH of 3, but on addition of urine containing protein, or that is albumin, at the same pH, it is going to change the color from yellow to green, to shades of green, blue color. So this is the principle of the arbustic or protein reagent strip, that we are utilizing a strip containing an indicator which is tetrabromopheno, and at acidic pH of 3, it is yellow in color, but if we add clear urine containing albumin, it is going to be converted to shades of green to blue color. So after this, we are going now to look at the procedure. And this shades of green to blue color formed depends on the intensity of the green color formed. The intensity is directly proportional to the amount of proteins in the sample. So the more the proteins, the more the green color is formed when we are using arbustic. And the method or the procedure of this method is that we are going to we assemble the requirements which we are going to use. Requirements like the arbustic or the reagent strip, then clear fresh urine. We shall need sometimes glacioacetic acid in case it is alkaline, if in case urine is alkaline. After assembling these requirements, even the tubes are needed. We are going to first measure the pH. First measure the pH of urine, and if you find it is alkaline, you add drops of glacioacetic acid. Add drops of glacioacetic acid to acidify. Here we are trying to acidify the urine because one of the sources of error is using alkaline urine. So we acidify, and in case the urine is turbid, we centrifuge. We centrifuge or filter to obtain clear urine. So the urine you're going to use must be clear. After obtaining clear urine, what we are going to do, we are going to obtain a heuristic, obtain the arbustic from its container, and immediately recap. You immediately recap the container. It is very important to recap immediately because entry of air is going to cause the reagent strips to expire. So after obtaining, you immediately recap the container containing the arbustic or the heuristic. Then you already have your fresh urine which is acidic, which is slightly acidic, and it is clear. So you're going to dip the reagent strip in urine. Then after dipping it, after covering the whole pad containing the indicator, you're going to tap at the edges of the container to remove excess urine. Remove excess urine from the strip. And after you have removed excess urine from the strip, you now leave it to stand horizontally. It has to stand in the horizontal position for 30 seconds to 60 seconds. After 60 seconds, don't read the heuristic beyond 60 seconds. So within 1 minute, you come and compare with the color standard. So if this is my heuristic bottle, after I have dipped and I have waited for 60 seconds, I come and I start comparing with the color standard on the bottle. After comparing, then we report. We come and report. And on reporting, we can report either proteins, can be proteins negative, it can be proteins trace, it can be proteins +1, +2, +3, and so forth. So it is semi-quantitative, so we record in pluses. So this is the method we can use for arbustic for determining urine. So the sources of error. Sources of error in this method is that one of them is when urine is alkaline. Using alkaline urine affect results. Using alkaline urine is one of the sources of error. It can bring false positive. So these are sources of error, or you can call causes of false positive results. False positive. One of them is using alkaline urine. Another one is using turbid urine. When you're using turbid urine is another source of error. Then another one is using urine containing sperms, presence of sperms in urine, or vaginal secretions. So vaginal secretions and the presence of sperms in urine causes false positive results. And even the presence of detergents like Jik, presence of detergents like Jik and tetrahexidine, all these ones can cause false positive results with heuristic, or what we are calling arbustic. So you have to always make sure that the urine you are doing is not alkaline, it is not turbid, and it doesn't contain sperms. And even when it contains, if the urine also contains, because we have seen sperms do that, and if the urine also contains red cells, if it contains much pus cells and even RBCs, it can also react. But majorly pus cells also make a false positive proteinuria. So it is very important to know the causes of false positive so that you don't say someone has proteinuria in these conditions. After looking at this now, the next method we are going to discuss is using sulfoxylic acid. Sulfoxylic acid is another method we can use apart from the reagent strip. And this SSA, which we are calling sulfoxylic acid, it normally comes in either you can use it as a 3% or a 25%. So you can prepare. But recently, the most accurate one is 25%. We have left 3%. So currently, we can use 25%. And the principle behind this SSA, that this SSA is an ionic precipitant. It is an ionic precipitant. So if you add it to urine containing protein, it is going to neutralize the proteins. It neutralizes the protein to form cloudiness, or it precipitates. In the presence of proteins, it precipitates the proteins. Precipitates the proteins. Precipitates the proteins in urine. Precipitates the proteins in urine, forming turbidity. This one, it will result into formation of turbidity or cloudiness. So this is the principle behind sulfoxylic acid, which is majorly we are using now 25% sulfoxylic acid, which is an anionic precipitant. And this anionic precipitant, we have said, it has ability to neutralize proteins in urine or precipitates the proteins found in urine, leading to formation of turbidity or cloudiness. That is the principle behind SSA. And the method here under SSA, or the procedure, if you want to determine the procedure states, you assemble the requirements which we are going to use. The first thing is to always assemble the requirements, like 25% SSA. You have to have it. You have to have tubes. You have to have the controls, the positive and the negative controls, and so forth. You must have fresh, clear urine. You must use clear urine. And after assembling these requirements, we're going to obtain the tube for the test, the tube for the control. Either it can be positive control and the tube for the negative control. So what you're going to do in each tube, labeled test positive and negative control, you come and add 5 mils. So we are putting 5 mils of 25% SSA, and after putting it inside here, then we come and add. For the test, we add 0.5 mils of urine. In the control, we add also 0.5 of the positive control, and here we add 0.5 mils of the negative control. Then we mix. After adding, you mix and you look for turbidity, look for presence of turbidity, or you can call it cloudiness. So on reporting, on the report, you can tell us that no cloudiness, means protein is negative, and if you see slight cloudiness, that is +1, moderate cloudiness, that is +2, then severe cloudiness or intense cloudiness, that is +3 proteins. So this is how we record the results after performing sulfur-cyclic acid. But if I see no cloudiness, means there is no proteins. I see slight cloudiness +1. I see moderate cloudiness +2. Severe cloudiness together with the precipitate. Severe cloudiness plus presence of a precipitate, that is a +3. So it is a semi-quantitative method. So this is the second method we have seen for determining proteins in urine. The last one we can talk about is the quantitative method using 30% TCA, which we call trichloroacetic acid. Trichloroacetic acid. So this is another method we can use, and this is quantitative. This is the only quantitative method we can use. Here we use different standards having results or concentrations. So here we involve using standards. We use different standards, then at the end we shall compare. So this is what we are calling trichloroacetic method, which is quantitative. And the principle here is that even TCA is a precipitant, so what it does, it precipitates. So TCA, when added, it is a precipitant, so it precipitates proteins in urine, leading to formation of cloudiness. So it precipitates protein in urine, and this one occurs in the presence of heat to form cloudiness. That is the TCA which we use. So it precipitates proteins in the urine to form cloudiness in the presence of heat. So here the requirements is heat. So you boil. Among the method we are going to use in this session of TCA, the procedure is that among the requirements, we must have clear urine, we must have standards, different standards, it is not one, and we should have 30% TCA. After assembling these requirements, you obtain tubes. This is the tube for the test. You're going to have different tubes for standard. Maybe this is standard 1, standard 2, and standard 3. So we have different standards, and in each we put 5 ml of TCA. In each tube you add 5 ml of 30% TCA. Then after adding 5 ml of 30% TCA, you obtain clear urine. For the test you put 0.5 ml of urine. And then here you put standard 1, 0.5 ml. 0.5 mils of standard 3 and standard 2. Then you mix. After mixing, what you're going to do is you're going to come and put these solutions. You come and put the solutions, all of them, the test and the standards, in boiling water. You put them in boiling water for 5 minutes. Then after 5 minutes of incubating in boiling water, that is providing heat, you come and compare. You compare the turbidity or the cloudiness formed with the standards. You compare it with the standards. And then you choose the one which matches. You choose the concentration. You choose the concentration, you determine or you report the concentration of the test by writing the concentration which matches with the standard. So maybe let me say the cloudiness of my test here has matched with the standard 2, and the standard 2 maybe it is 50 milligrams per deciliter. So I will come and record 50 milligrams per deciliter. So the standards have known concentrations of protein. So because I have many types of standards, so I get the standards and I compare and I look for which one is matching with the standard, and I record the concentration of that standard. And that's why we say it is quantitative. So here we record in milligrams per deciliter. But even the aerobatic is also quantitative because currently the heuristics or the aerobastics have the concentrations. You can see in this session we have not discussed on the heat method because heat method is not appropriate method for using current. So that's why I'm not discussing about heat method. So thank you so much for learning with us from the beginning until the end, where we have looked at the causes of proteinuria. We have talked about the different methods we use, like aerobatic, SSA, that is 25%, and we have looked at also 30% TCA. And we have said the heat method is not recommended because proteins tend to coagulate in the presence of heat, and you cannot obtain good or clear results. So thank you so much for learning with us. May God bless you.